Hello, my name is Massimo Volpe. I'm a professor of cardiology in the University of Rome, Sapienza in Italy, and I'm responsible of an excellence hypertension center in Europe in my town. I want to talk about the new guidelines of hypertension released by European Society of Cardiology and the European Society of Hypertension, and in particular, I would like to make a focus on the need that is recommended by guidelines to control blood pressure early in life. This is extremely important to avoid that the hypertension as a progress towards a high risk or a very high risk situation in which it's more difficult to reduce the risk at one time, and on the other time is more difficult to control blood pressure because the vessels become more stiff and it's complicated to control blood pressure. So now the guidelines suggest to get control within 3 months, which is an ambitious target, but it's a very important message. The message is important because every doctor should do his best or best to try to control blood pressure immediately, possibly using combination therapy. From this point of view, almost 3/4 of the patients with hypertension require, according to the guidelines, to start with combination therapy in a single pill, and this is based mostly on blockers of the renin-angiotensin system such as ARBs or ACE inhibitors, plus a diuretic or plus a calcium antagonist. Well, this initial combination may lead to control blood pressure in a fair amount of patients, and if doesn't work, one can step up to a triple combination, eventually in a single pill, putting together a RAS blocker and CCBs and a thiazide diuretic. If this doesn't work, other drugs are available, such as beta blockers or mineralocorticoid antagonist. Well, the scope of treating early blood pressure is to avoid the progression of target organ damage and to avoid the onset of cardiovascular outcomes. Beside the need to use combination therapy, it's important to personalize the therapy according to the eventual comorbidities, and also to use drugs which are lasting at least 24 hours. So within each class, it is preferable to choose long-lasting drugs. And in this way, you can control either the escape of blood pressure in the morning or an extreme variability. Finally, a recommendation of the guidelines is to not only check the blood pressure and control blood pressure, but also at the same time have an early control of concomitant risk factors. Altogether, we believe that this will bring to a better control of cardiovascular morbidity and mortality in hypertension, and to reduce the burden of cardiovascular disease associated with hypertension.